I'm Dr. Randy Fagin. Welcome to a four-part series on building your daVinci surgery program. All four of these pieces are critical to the core of building your daVinci surgery program. They're meant to be watched in series, so I would encourage you to watch them 1, 2, 3, and then 4. This first one deals with reducing variability. Reducing variability is a really important concept when we're talking about building a daVinci surgery program. And there's a couple of things we need to understand. We need to understand why are we going to reduce variability, and how are we going to do it. On the why end, there's three things that reducing variability will do for your daVinci surgery program. It will improve the quality of what you do, it will improve the revenue that you're able to generate, and it will improve the success of the program. On the quality end, it's interesting, reducing variability, this is not about being faster or moving quicker. This really is about an increased attention to detail and a systematic approach to mistake proofing. So when I come home every day from work, I enter into our garage, and between the garage and the house is this mudroom. And in the mudroom is the drawer, and in this drawer there's this box, and when I come home, I take my wallet, my keys, and I put them into the box inside the drawer, and I close the drawer. If there's something in that drawer or in that box, I remove it, and I put my wallet, my keys there. And I haven't lost my wallet or my keys in like 20 years. I mean, this systematic approach to mistake proofing has improved the quality with which I'm able to make sure that I don't lose my wallet, my keys. And we do this all the time in our lives. Surgeons do this by doing the surgeries the same way every single time. Nurses do it when they interview patients the same way every single time. Surgical techs set up their back tables the same way every single time. We all do these things, these systems to mistake proof, and it drives the quality. So when we reduce the variability in how we do things, we improve the quality of what we're able to do. On the revenue end, as hospitals, as surgeons, we get paid for doing something, not for how long it takes us to do it. So if we're able to reduce variability, and in doing so, do more stuff per unit time because we're more efficient with our time, we can increase our throughput, we generate more revenue. So the more throughput we have in the same period of time, the more revenue we can generate. The success end is actually a little bit more interesting. When we reduce variability, when we become more efficient, we actually create this procedure credibility. It builds a brand. If I were to go into a hospital and I say, okay, my mom lives in northern Wisconsin, which she doesn't, but let's pretend. My mom lives in northern Wisconsin, and I want to find a surgeon to get her so she can have a daVinci hysterectomy done. And I call up the nurse in the hospital. I say, okay, my mom needs a daVinci hysterectomy. Who should she go see? They say, okay, I've got all these surgeons that I can refer you to. You asked for a daVinci surgeon, so I'm only going to look at these guys that do daVinci surgery. Out of these folks who do daVinci surgery and do hysterectomies, I then say, you know what? These folks I really don't like as human beings, so I'm going to look at just these guys, just these folks here who I happen to like as people. So now we've got a bunch of doctors who you like as people who do daVinci surgery and they do hysterectomies. Out of those folks, you say, you know what? Nice guy, wouldn't trust him to operate on my dog. So now I've got a bunch of folks who are daVinci surgeons, they are nice people, and they do a decent job at surgery. Out of those people, who do you pick? Who does a nurse pick to give me one name? She picks the guy who does a daVinci hysterectomy in like an hour when everybody else does it in like 2 hours and 10 minutes. Why? Well, because he's better, right? Well, no, I mean, he's just more efficient. He's reduced variability to the point that he's more efficient with what he does. We associate being more efficient with being better. This guy may have the same outcomes, the same length of stay, the same blood loss, the same everything, but we think of him as better. And as surgeons, we're just as guilty of it. I mean, you ask a surgeon, which hospital do you like more? It's like, oh, well, I like this hospital over here. Well, how come? Well, I've got more on-time starts. I have less turnover time. They can do more cases per day for me. The nurses on the floor know what I need. When I get there to pre-op, they always have my labs. You will never hear a surgeon say, I like to take my patients here because when I go there, my outcomes are better. No, what surgeons say is this is a better hospital, but if you listen to their words, what they're describing is efficiency, reducing variability. That drives success. It drives a brand. So how are we going to do it? There's three things that we can leave here today and just go to your hospitals and do. If you can reduce variability in these areas, you will significantly improve your ability to build your daVinci surgery program. So room layout, personnel, and stuff. Okay? So on the room layout end, it's amazing to me to walk into hospitals and see that, oh, when Dr. A does a robotic case, the patient cart's over here, and this is over there, and the Bovie's over there. But when Dr. B comes in, well, then we have to move the Bovie over here for him, and we rotate the bed this way because he does side docking, and we move the console over here. Total craziness. In our operating room, we have 3 daVincis and 3 different ORs, and our rooms are all set up like this. This is our setup. The tower, the bed, the patient cart, the back table, they're all in the exact same place. Now, from room to room, the location of the door may vary. You might enter from here, you might enter from here, you might enter from here, but our room looks the same. Whether you're doing side docking or front docking, or if you're doing kidneys, you don't need to rearrange the room. Pick one setup. This setup is going to be your home. This is how people are going to know where things are. It's how they're going to function comfortably in their environment. You say, well, what about if I'm doing this is fine for side docking, but what about for a prostate? These beds are on wheels, so unlock the bed, rotate it, and have the bed face this way. For a kidney, fine, rotate the bed all the way if you need to. It doesn't matter. The bed is the only thing that should move. If you can standardize, you can reduce the variability in the layout of your room, it will significantly improve your people's ability to function within it. Okay, how about personnel? Let's take an example here. So if we look at an average daVinci program, they've got like 8 different surgeons, 4 techs, 3 circulators, 5 anesthesiologists. Not a very big program. But just in this group of people, this small group of people, there are 480 different personnel combinations. Seriously, that means if I were to walk into this hospital's operating room, I would have a 1 in 480 chance of finding the same people, the same staff in that room. That's crazy. I mean, no wonder doctors walk into an operating room and say, people, we've been doing it this way since 1997. Why can't you get it right? I was with a doctor actually a couple of weeks ago who said it so often that his staff actually wrote, they painted above the door in the OR, we've been doing it the same way since 1997. No wonder they feel that way, because less than once a year will they walk into a room and it will be the same team, statistically. This is a problem. We can fix this though. It's easy. Create a consistent team. A core nurse, somebody who is kind of at the heart of this, your core tech or 2, a core anesthesiologist or 2. These folks who are in the room 80% of the time. I mean, I know it can't be 100% because you got to backfill folks and the operating rooms are variable and you got to move people around. Commit to 80% that you're going to have the same core team in there. This consistent team, they're going to be rock stars. They're going to be so good at this that is essential to building your daVinci surgery program, to have a consistent, strong team. Okay, how about stuff? Hospitals are real good at thinking that they are improving the efficiency of what's going on in the operating room, reducing variability. They say, okay, you know what? We know that doctors' hands come in all different sizes, so we are going to take every glove you could possibly want and put it onto this cart. And no matter what glove you need, no matter what case you're doing, you go here, your glove will always be there. Oh, and suture. We know that doctors use different sutures, so every suture on the planet that our doctors use, all in one spot. Don't need to run around for it, just one place, any suture right there. Hey, laparoscopic cases, no problem. We're going to put all of your trocars, all of your disposable laparoscopic instruments, your staplers, your scissors, it's all going to go right here on our laparoscopic cart. Ooh, robotics? No problem at all. We're going to create a cart with every robotic instrument that we use, all those little green caps, everything that you could possibly need for a robotic case that's disposable, it's all going to be right here. Problem is, when you do a robotic case, you need all this stuff. So you're running all over the planet to get your gloves, get your suture, get your trocars, get your robotic stuff. In an effort to be efficient, they've actually made us less efficient. What you need to do is you need to say, okay, I'm going to take the essential things I need for a daVinci case, and I am going to move my point of storage to one location, and I'm going to move it as close to the room as physically possible. In the room would be awesome. Close to the room, almost as good. So our gloves, our suture, our trocars, our daVinci stuff, we're going to move it all to one place, hopefully in the room. We want that nurse to stay in the room as often as possible, and if she needs to get something, we want it to be in the room or immediately outside the room. How about trays? You can do this with robotic trays too. Unfortunately, hospitals are notorious for saying, okay, we've got our daVinci GYN tray, we've got our laparoscopic, and that's all wrapped up in blue wrapping, and we've got our accessories, and they're in a separate little box with blue wrapping. We have our open stuff that you need to make your incisions and close the wounds, and we do this for our general surgery trays, for our urology trays, and goodness gracious, God forbid you do it like for each surgeon, so the doctor gets his name. Ooh, his name is like written in like felt tip pen on the outside of a blue wrap. This is not a very efficient way to run your operating room. In our ORs, we actually have one tray for daVinci, lap, open, and accessories. All that stuff is in there. And for any daVinci case that's being done by a gynecologist, a urologist, a general surgeon, a bariatric surgeon, a gynecologic oncologist, doesn't matter. This one tray has everything in it. And this improves not just the efficiency of getting it set up and broken down, this also improves the efficiency of those folks that are filling it, that are putting stuff in it. If it's the same every time, they're going to get it right far more often. It's going to help your folks in central sterilization. They can create patterns of how they're going to sterilize stuff because it's the same every single time. One simple act of standardizing a tray will impact multiple areas of your hospital in improving the efficiency with which they can function. Reducing variability improves efficiency, improves quality. All these things are important to building our daVinci surgery program. So, what are we going to do about variability? Well, why? Why are we going to do it? We're going to reduce our variability because we know it improves quality, we know it improves revenue, and we know that it drives success. What are we going to do? We are going to standardize our room layout. You're going to find one way that the room should be laid out, and we're going to leave it that way, and the most you're going to do is rotate the bed. You're going to standardize your personnel. These are our core team members. These are our rock stars. They are going to be awesome, and they're going to be in this room at least 80% of the time. And you're going to standardize your stuff. You're going to say, you know what? All of our stuff that we need for robotic cases, we're going to store it in one place, hopefully in the room, if not pretty close to the room. And we're going to standardize our trays so that what our surgeons are using, it's one tray, same all the time. That's going to help multiple departments. Okay, so that's reducing variability. I'd encourage you to continue on and watch using parallel tasks, leadership and communication, and the performance enhancement cycle.